Let's discuss diagnosis according to 8 principles. Heat, part 2. Exterior excess heat. When there is exterior heat, there will be signs relating to the disturbance of qi or to the muscles and joints, such as in this syndrome. The only zang organ that can be affected immediately by invasion of excessive in the exterior is the lung. This is because exterior evil heat will disrupt the functioning of qi, which is controlled by the lungs. When there is exterior excessive, there is no disturbance of other internal organ physiology. The pulse will be superficial and rapid because evil chi is in the exterior and because there is heat. If there are any changes seen on the tongue, this will be visible on the tip and or the sides, which will be red, and there may be a thin yellowish coating in these areas. Exterior heat symptoms and signs will be acute. Interior heat symptoms and signs will be more chronic in nature. But there may be acute episodes. This is often on aversion to wind and cold during an exogenous invasion of heat because Wei Qi is disturbed. This will not be the case when there is a condition of heat in the interior. On the contrary, the person will often have aversion to heat. The thirst will not be as strong as there is heat in the exterior. This is because heat is starting to injure the body's fluid, but not to the same extent as when there is heat in the interior. So we have here the differences between interior and exterior heat. For the interior heat, most often chronic, but there may be an acute episodes. For the exterior, it is acute. For the interior heat, may be due to one or more of the 6 climatic forms of evil chi, the 7 emotions, and diverse causes. For the exterior heat, it is due to one or more of the 6 climatic forms of evil chi. For the interior heat, can be deficient or excess condition, while in the exterior heat, it is an excess condition. For the interior heat, it affects the sunk organs, while the exterior heat, chi, muscles, joints are affected. For the interior heat, there is disruptions of body's internal physiology. For the exterior heat, the body's internal physiology is not disrupted. For the interior heat, the pulse can be deep or superficial, while the exterior heat, the pulse is superficial. For the interior heat, the entire tongue can be red, or the tongue can be red in an area that corresponds to a specific organ that is affected by heat. There can be both a yellowish coating or a lack of coating, depending on whether it is an excess or deficient condition. For the exterior heat, the tip and the sides may be red, and there may be a thin yellowish coating in these areas. For the interior heat, there is no aversion to wind and cold, while sa exterior heat, there is slight aversion to wind and cold. For the interior heat, there may be a strong thirst, while exterior heat, the thirst is not so pronounced. There is a rapid body movements for the interior heat, while for the exterior, normal body, it is a normal body. There is normal body movement. For the interior heat, there is rapid and verbose speech, while for the exterior heat, there is a normal speech. For the interior heat, Shen may be affected, while exterior heat, Shen is not affected. There may be bleeding for the interior heat. In the exterior heat, no bleeding. For the treatment principle of the interior heat, either drain heat or nourish yin, while for the exterior heat, we have to expel wind heat. Let's go to the etiology. Excessive can arise in several ways. Excessive intake of foodstuff, beverages, and spices that have a warm or hot energy. Typical example of these are chili, garlic, pepper, alcohol, lamb, fried foods such as chips, falafel, crisp, and so on. This will be especially relevant when there is heat in the liver, stomach, and intestine. Prolonged emotional imbalances like stress, frustration, and anger will create heat in the heart and liver. Smoking tobacco creates heat, especially in the lungs. In patients with exogenous chi, heat can directly invade the body. The invasion can be via the exterior or directly into the interior. Invasion of exogenous flow can transport the heat in the interior. Internally generated evil chi, such as dampness, can transform and become damp heat. For the symptoms and signs, there is thirst, aversion to heat, skin may feel warm when palpated, the face can be red or woody, discharges and exudations that have changed color and become yellowish or greenish. There is excretion that have become sticky or thickier. There is excretion that smell or taste strongly. There is pain that is throbbing, stinging or burning. There is excessive sweating or lack of sweating. There's constipation, red tongue, and rapid pulse. The key symptoms we have to observe is the thirst, aversion to heat, red face, red tongue, and rapid pulse. For the treatment principle, we have to expel or drain heat. Thank you for your attention.